Hello, my name is Francisco Carnevale. I'm an interventional radiologist from the University of São Paulo Medical School here in Brazil. And it's a really honor for me to be here presenting the results of a paper published in CVIR Endovascular this year. And that is a multicentric study. And right now, I'll present to you the important data that we have found with this paper. As you may know, prostatic artery embolization has been established as a new alternative of treatment for patients with lower urinary tract symptoms related to benign prostatic hyperplasia, BPH, in patients with enlarged prostates. However, we know that this procedure is technically demanding. This procedure remains technically challenging due to complex vasculature, anatomical variations, and really small arteries that we have to deal during the procedures. It results in long procedure times, high radiation dose, both for us, interventional radiologists, and also for the medical staff and for patients. Another important issue, and when we are talking about prostatic artery embolization, is that the risk of non-target embolization can lead to relevant complications, mostly to the pelvic organs that we have around the prostate. So the use of advanced imaging softwares like Conbin CT and related softwares like the EmboAssist from GE Healthcare that we have started to use, and we developed this software in some groups that will tell you our experience. It has brought strong data to prostatic artery embolization. So what we have done, we worked in a consensus panel, a consensus imaging workflow with 4 international institutions, 1 in Europe, 2 in the United States, and 1 in South America, here in São Paulo, with experienced interventional radiologists in prostatic artery embolization. So this workflow was established with the objective of better visualizing the anatomy, better planning the procedure, guiding and assessing the procedure, while minimizing radiation exposure for patients and also for clinical staff. We do believe that reading this paper, interventional radiologists and other physicians who take care of the patients with lower urinary tract symptoms related to benign prostatic hyperplasia, they will understand how we can have a better understanding of the prostatic artery embolization procedure, indications and techniques, and also how to get better results with this procedure. So this technical note aims to share the experience of 4 institutions detailing our optimized workflow using advanced image guidance, discussing variants and sharing the best practices to reach a better workflow that we have developed for physicians who want to perform prostatic artery embolization. We found a way to deliver good clinical outcomes. We need to improve the technique and the long-term results of this procedure, prostatic artery embolization, trying to achieve the same results of traditional surgical techniques. So we were able to deliver good clinical outcomes, minimizing radiation dose levels, and also the use of contrast media, and making prostatic artery embolization procedures shorter and also safer. Finally, and really important, the second generation of this study done at the University of São Paulo Medical School, and that we are able to present this year in Barcelona during CIRSE 2022, has shown that with this protocol, we were able to identify 4 times more prosthetic arteries using Cone-beam CT with the software EndoAssist comparing to the traditional DSA when we were using only digital subtraction arteriogram. So if the aim of prosthetic artery embolization that we know that is really important is to identify any prosthetic branch and embolize all these prosthetic arteries, and with this technique that we are using, we are able to find more prosthetic arteries, 4 times more, using this consensus protocol. The consequence of that is that we can have better results for patients. So in conclusion, we can say that it is a different way to perform prosthetic embolization and achieve better results for our patients. That's the main message that we were studying and from this multicentric study.